Oh, thanks, David, and hello, everyone. I will echo David's opening by acknowledging the traditional owners, custodians of the land on which we're meeting today. I'm talking to you from Ngunnawal country in Canberra, and I pay my respects to elders past, present, and any Aboriginal and Torres Strait Islander people who are joining us here. The topic for discussion is a broad one, somewhat ambitious, I think, and I have a lot of ground to cover in the next 30 minutes or so. By necessity, it will probably be fairly high level, but on occasion I probably won't be able to help myself, and I might go into some of the detail. And if we're lucky, there'll be a time for a few questions at the end if you have particular issues that you want to follow up. Let me start by giving a demographic outline. Now, David's signalled that this is an area of growing interest for all Australians and indeed internationally, as increasing the population experiences all the benefits of increased life expectancy, and we have a greater proportion of individuals in our population who are over the age of 65, 75 and even 85. Now, this slide is very busy. Let me just give you some navigational aids. The aged care in Australia that is subsidised by the Commonwealth Government is split into a number of categories. There are three large categories. One is home care packages, the second is community home support program services, and the third is residential aged care. Now, there is not an exam on this slide, so you don't have to study it in detail, but the key takeouts are that there are around 140,000 consumers currently receiving aged care package, around 840,000 consumers participating in a community home support program service, and around 190,000 residents in an aged care home across Australia. Now, in total, that's around 1.2 million people. So it is no modest enterprise. Aged care in Australia draws billions of dollars of funding every year, and it is a very significant marketplace and area of utilisation of social care. I've included the bar chart on the right to give you some sense of the age splits, the cohorts in residential aged care. Now, if I put this slide up 20 years ago, the whole curve would have been shifted to the left. There has been an ageing of this cohort progressively in 5-year slabs, as it were, and you now see the largest number of aged care residents is in the 85 to 89-year-old age group, which is astonishing when you think about it. And over half of them have some degree of cognitive impairment, which goes to the complexity of the care responsibility and the care environment. So before I delve into the transformation journey, I wanted to just make sure you were broadly familiar with the role of the commission I lead. I lead the National Regulator of Aged Care, and under our Act, we have 4 principal functions which are set out on this slide. And I'm not going to go into the detail, but just high level: consumer engagement, education, complaints resolution, and this rather omnibus category called regulation. Now, that's confusing for people because, aren't you the regulator? Isn't that what you do? Yes, it is. But there are some functions which are specific to that language, and you can read them in that block there. Approving providers for aged care, accreditation, performance assessment and quality audit, monitoring and enforcing compliance, and training of quality assessors. So that is a very substantial scope of work that we undertake right there. Essentially, if you were to drill down, what we do is hold providers to account for the quality and safety of care they deliver to aged care consumers. That's it in a nutshell. Now, I've included this next slide because sometimes the next step in people's understanding of what the regulator does is to think, oh, okay, so you're the oversight body. You make sure they do the right thing. And I actually designed this slide specifically to ensure that there was a more comprehensive understanding of how doing the right thing is assured in the aged care sector. In the middle circle is the consumer, the person receiving care. The next circle out are the people providing care. And if that relationship is not working, then there's nothing that the regulator can do, which is another couple of steps out, which is actually going to make it right. So we are relying on the interaction, the quality and the safety of the interaction between the consumer and those who are providing care to the consumer. And if that's working well, then the approved provider, who is their employer, is doing the right things in overseeing their practice, and the regulator, one step further out, has less to do. But if that's not working well, then we have to get in close. We, as the regulator, hold the provider to account for the quality and safety of the care provided by that staff member to the consumer in receipt of care. Okay, so there's so much unpacking that could be done there, but let me move on to the Royal Commission. The Royal Commission into Aged Care Quality and Safety commenced before the commission I lead actually came into being. We started, as David said, on the 1st of January 2019. The Royal Commission was initiated in late 2018. Now, it came as a bit of a shock to a number of people, but we quickly understood why it had been established and what its remit was. The findings, which were delivered in February this year, can be summarised by that quote. They found inexcusable levels of substandard care in Australia's aged care system, reflecting poor quality on the part of some aged care providers and systemic flaws with the way the Australian aged care system is designed and governed. Now, I've listed 8 areas where the system was found wanting, and I don't propose to go through all of them in detail, but I have included them here because I want you to do your own reckoning. In subsequent slides, I have set out aspects of the Commonwealth government's response to the Royal Commission recommendations, and I want you to undertake an informal audit. Has everything been covered? And I can assure you many people have done that, and it is a very comprehensive response. So just very briefly, the Aged Care Act needs redrafting, so that's the first one. Program design does not allow everyone who wants to be supported safely to remain at home to do so. So we need to look at that. There are a whole raft of funding and financing issues that need to be addressed. There are issues in relation to the workforce supply and their skill level. The ways in which providers manage and oversee the delivery of care requires attention. We have issues around data collection, analysis, and the transparency of provider performance. We need to spend more time and effort in research and innovation across the sector, and the regulation of the sector needs work. Yes, the commission I lead needs to look to what we're doing and how we can do it better. So, the government's response. 148 recommendations, 126 of them approved or approved in principle, and the balance there, 4 where an alternative was supported, 12 which is subject to further consideration or noted, and 6 which weren't accepted, 4 of which were matters of contest between the 2 commissioners. So they didn't agree among themselves, and the government said, well, we're not going to agree with either or. We will understand both those positions and determine a path forward. So on any measure, a very substantial support for the Royal Commission's work, where they landed and what they recommended needed to be done. Moving across to the centre of this slide, what the government announced on the 11th of May, which isn't that far back, as part of their budget announcement was a 5-year, 5-pillar program, once in a generation transformative change. And any of you who have looked at the government response, I think, will agree with that characterisation. The 5 pillars are home care, residential aged care services and sustainability, residential aged care quality and safety, workforce and governance. $17.7 billion additional funding over the 5 years, and a clear roadmap for the changes, the very significant changes that are seen to be required and to which the government has committed itself. Now, I'm going to give you a brief survey of the 5 pillars, and I make no apology for having used a regulatory lens. So I certainly am not holding this out to be a comprehensive survey. I do not deal with every aspect of the government's response. What I've done is saying, well, I'm a regulator. These are the ones which resonate most with me, and many of them require my organisation, my commission, to do something. So let's start and move through each of the 5 pillars. The first is home care. There will be a redesign of the home care sector, which is already underway, to bring together and reposition home care packages, Commonwealth Home Support Program, short-term restorative care, and residential respite programs. It is undergoing a redesign literally as we speak, in order to better support people who would prefer to remain at home safely and with the necessary level of support to enable them to have a decent quality of life in that environment. There will be improvements in access to packages, with a very substantial additional number of packages having been announced, 80,000. My commission is being resourced to increase our number of frontline staff, particularly because there's this general and high level of growth in home services. So we need more staff because each of those services has a regulatory component to it. We have already made steps and will continue to reform our regulation of the home services sector, making sure that we keep up with the redesign project so that our regulation remains fit for purpose. And the Department of Health, alongside us, will be undertaking a program assurance review function to look at the proportion of total costs represented by the administration fee, and to ensure that there is some downward pressure applied to that fee so it doesn't consume too much of total costs. So that's a very quick tour through Pillar 1, and it would reward closer reading. If any of you online have a strong interest in this area, I really do commend the full response to you. Pillar 2 is sustainability in relation to residential aged care. So this, unsurprisingly, goes to financial and prudential monitoring, which is another job for the Commission, and we're already looking at the ways in which we would strengthen our regulation of the money management aspects of residential aged care. There will be, and indeed there is, work underway to introduce a new funding model for residential care, which is going to be a game changer. Those of you who currently work in the Australian healthcare sector would be familiar with activity-based funding. The new funding model for aged care is very similar insofar as it identifies categories of resident based on care needs, and then costs those care needs, and the costing flows through to a pricing and ultimately to a funding arrangement. It will literally transform in and of itself a number of the settings in aged care. It will also make additional funding available to aged care providers, residential providers. There will be work underway on a star rating system specifically for consumers and family members to be able to judge and compare one residential service against another. There are new requirements being introduced in relation to mandating care time standards. So an average time per resident per day of care of 200 minutes, and also an obligation for residential services to have an RN on site for 2 shifts out of every 3, so 16 hours in every 24. And there is also, and I made a point of including this, there will be work on national design standards so that we are paying more attention as new facilities are built to best practice design considerations for people who have dementia and some degree of cognitive impairment, who need different wayfinding arrangements to ensure that we minimise confusion, they can orient themselves in time and place and understand where they are and where they want to go. Really important initiative as far as I'm concerned. That's Pillar 2 in a nutshell. Pillar 3, is where the Commission has most work to do. And this, in fact, is spread across 2 slides. Aged care, residential aged care quality and safety. The quality standards, 8 standards, 42 requirements, are going to be reviewed with a particular focus on looking at their clinical component and working with the Australian Commission on Safety and Quality in Healthcare to revise and upgrade, if you like, or certainly update clinical care standards nested within the aged care quality standards. Now, that's a very substantial piece of work. It will proceed alongside another aspect of that initiative, which is to look for alignment where possible with the standards which apply to disability services and to veterans care, because there is a very live view across government and throughout social care that there are standards which are similar in content and impact, which can be applied across each of those sectors: aged care, disability service and support, and veterans care. So why have discrete standards when in fact you can join them up at a high level and place the same expectations across providers in each of those categories? So that is also work which is happening alongside the review of the aged care quality standards. There is a commitment to introduce additional quality standards and to also introduce measures going specifically to the consumer experience and their quality of life. No easy task, and internationally there have been attempts made at this, some more successful than others, and we have a lot to learn from the international experience. The Serious Incident Response Scheme, which is recently introduced in residential care, and about which I'll have more to say shortly, as well as a quality indicator program, will also be moved and introduced into home care, which is not for the faint-hearted. There's a lot of design work we need to be done in the next 8 or 9 months in order for that to happen in 22-23. And there will also be additional resources for the Commission I lead in terms of recognising that there is a general growth in all aspects of the work we do now in resolving complaints, in assessing and monitoring performance, and in taking compliance enforcement action where we find non-compliance. Now, the second slide under Pillar 3 goes on to talk about a stronger regulation of the use of restrictive practices in residential care, which has just been introduced through legislative amendment, and I'm happy to talk about that a bit more. We have work underway across the sector in lifting providers' capability in managing individuals with dementia who have behaviours of concern. We have a pharmacy project which involves visiting remote services and spending time with them on the need for deprescribing of psychotropic medication and generally in medication management issues to assist them in getting it right for residents every time. And there has been announced that there will be a review of the Aged Care Quality and Safety Commission, the commission I lead, in calendar year 2023 to make sure that the independent regulator going forward is fit for purpose and doing everything that's required of this organisation. So that's Pillar 3. There's a lot happening there. Pillar 4 is workforce, and a lot of investment going in here as well on the basis of the findings of the Royal Commission. A very significant investment, millions of dollars over the next 5 years, in increasing the number, the training, the upskilling of the aged care workforce. There will be financial incentives put in place to attract and retain registered nurses as part of this workforce, an essential part of this workforce. Additional training places will be funded for aged care workers in vocational education and training courses to ensure that they have the right skill set. There will be introduced a single worker code of conduct across disability services, aged care and veterans care, and the Commission, going to the final point here, will be given responsibility for enforcing that code across aged care and veterans care, which will be enabled by a national registration scheme and a worker pre-screening scheme that is going to be introduced in coming months. So there's a fair amount of work, as you can understand, interpolating between each of those dot points in relation to workforce. And then the fifth and final pillar is in relation to governance. And in some ways, you feel as if this might almost be the first, because the lead out dot point here is a new act. Now, that is a very substantial undertaking. That will take 2 years. It's already well underway. It's 450 pages or something. It is enormously complicated and an enormous act physically. And revising it, redrafting it to ensure that it is fit for purpose, not just in 2021, but for following years, is a very substantial enterprise, which will involve very significant consultation, not just across the aged care sector, but across the broader community, I expect. There will also be, and indeed they've already been introduced as a bill in the House of Representatives on the 1st of September, new obligations placed on aged care provider governing bodies, so boards of directors or similar, and leadership cohorts, so CEOs and other senior leaders across the sector, in relation to the way they lead and they hold their organisations to account. There is a new position within my commission, an Assistant Commissioner for Sector Capability, which will have responsibility for working concertedly with leaders across the sector to ensure they understand their governance and accountability responsibilities. And then there's a new architecture planned for sector governance. A council of elders, which as the name suggests, will be comprised of older Australians, notable older Australians, influential and well-informed older Australians who will advise government. There's going to be a National Aged Care Advisory Council put together, and very shortly. There'll be a reformed Independent Hospital Pricing Authority, which will take on aged care pricing, and also to be established an Office of the Inspector General of Aged Care, who will sit in judgment and scrutiny of the entire system. So there's a lot of framework development there, with new bodies overseeing the entire sector and its operation and performance. And there will also be a local network of departmental aged care staff built at the regional level, which is sub-state, in order to get closer to aged care providers, hear their voice more clearly, and make sure that they can establish the sort of relationships with those providers which will enable them to perform at their peak at all times. So those are the pillars. Now, let me move on fairly smartly to talk about briefly the reforms already underway. I've mentioned the Serious Incident Response Scheme, and I hope some of you are familiar with the architecture of that scheme. It has been designed and introduced from the 1st of April to require providers, residential providers, to have in place an incident management system through which they manage all incidents which have an impact on a consumer, an adverse impact on a consumer. So fundamentally to manage those incidents, to learn from them, to take action to mitigate the impact, any risk of harm on the consumer, but most particularly to take action to prevent it from happening again. It also introduced obligations for providers to report incidents to the Commission in order that we can be assured they are taking appropriate action. Now, there's a lot more detail there, but let me move on to talk also about restrictive practices. I've already mentioned them briefly. New obligations came into force by virtue of legislative amendment from the 1st of July, which have strengthened provider obligations to minimise the use of restrictive practices, physical restraint, mechanical restraint, chemical restraint, environmental restraint and seclusion, to minimise the use of those practices in residential aged care. They're also required to have in place a behaviour support plan for any consumer who is subject to a restrictive practice from the beginning of September, so live right now. And I am in the process of appointing a senior practitioner to assist the sector to get to grips with these new obligations and to understand how behaviour can be managed without resorting to restrictive practices. And then we have a raft of legislative amendments which have been introduced into the House just last week. I've already mentioned those which relate to provider governance. And the Commission is undertaking a very substantial tendering process right now to secure a training provider to roll out a governance training and uplift program to the sector beginning from December and moving into next calendar year and the following calendar year, to ensure that governing bodies and senior leaders across the sector understand their responsibilities and are accountable for the safety and quality of care that's delivered through their services. I've mentioned that the Serious Incident Response Scheme, SIRS, is going to be rolled out to home services, and there's an enormous amount of work underway in designing how that scheme will be adapted and implemented in home services. There is on the right hand of this chart regulatory alignment, which I've also talked about, options being explored to support the alignment of the regulation of the aged care sector with the regulation of the disability services sector and veterans care, so all aspects of social care, so-called, and legislation recently introduced to enable sharing of information between regulators of each of those sectors. And then worker screening and code of conduct, again, I gave it a quick mention on the way through, a national worker screening and registration database to be established with assistance from individual states and territories. It already exists now for disability services in the NDIS, and we are looking to harness that platform and enable its use also for aged care workers. And then adopting a code of conduct for workers and indeed also for providers if the legislation in the House goes through and is passed by Parliament, in order that individual workers and providers are held to account for their conduct at a high level, at the level of principle, and we can check their compliance with the code as they go about delivering safe quality care, which it delivers the best possible experiences and outcomes for individual aged care consumers. Now, I've moved through at a very rapid pace, David, and I'm certainly able to and very willing to see how I can manage any questions you might have for me. Thank you.